You're watching KTN. This is KTN Sunrise Live. Today is the 27th of September 2012. And in this part of the show, we do take some time to let you know what's happening around us, what's happening in our community, what's happening in the society, and some of the changes that we might be expecting. Today being a Thursday, we'd like to delve a little bit into health and find out from you exactly what you could know about your own personal health. And today we're going to basically talk about kidney complications. And in case you have any question you would like to ask, we've got a nephrologist in the studio with us here. That is Kavita Parihar, who is from the Apollo Hospitals, and she's going to be here to tell us more about what we need to know about our kidney and how exactly you can tell that you might be having a kidney complication. Well, today that is going to basically be part of the issues we're going to talk about. Well, do welcome with me Kavita Parihar, who is a nephrologist, and also Jignesh Sanghavi, who is the GM Group Marketing for Kenya, Uganda, and Ethiopia for the Apollo Hospitals. It's a pleasure to have you in studio. Good morning.
Happy to be here.
Well, it's a pleasure to have you in studio. Good morning. Well, we'll just get straight to the issue. In Kenya today, we have increased number of people with complications, or that is kidney complications. And would just like you as a nephrologist to just briefly tell us about, you know, how important the kidney is to the rest of the body.
Okay, kidney is a very important part of the organ of the body. Most of the waste products which the body produces during the day are thrown out of the body through the urine. So you need your kidneys to maintain your blood volume, in the sense if you drink more water, you're supposed to pass more urine. If you drink less, it is supposed to decrease it. All the waste products are supposed to be thrown out. So any damage to the kidneys would affect all these functions. So you would get swelling of the feet because your kidney is not producing enough urine. The metabolic waste products which have to be thrown out are accumulated in the body. So that causes various signs and symptoms. You would not be able to eat. You would get tired very easily. You may be short of breath. So all these are the symptoms of kidney diseases if the kidneys are not working the way they should be working. It also increases the hypertension. So very importantly, what I have realized is that in India we have diabetes as a primary cause of kidney failure. But in Africa, I think genetically they're prone to more of hypertension. So if you control your diabetes, hypertension well, at least that much you can prevent, or at least slow the progression of if you have a kidney disease or kidney failure.
Right. Well, I would like to also get into the latest or the technology that is used when it comes to diagnosing some of the kidney, complications. And this is where I will come to Mr. Sanghavi, who probably, can you just enlighten us on what kind of technology is normally used to diagnose these kidney complications, or in the past as compared to what we have now, and if there are any latest technologies for that matter?
Right. I mean, I would just introduce, Apollo Hospital Group is a group of 54 hospitals, and we have been pioneer in bringing new technologies in India. So something where, I mean, the major technology changes which are happening at the moment, the conventional surgeries are done where a surgeon is there in the operation theater, but now Apollo Hospital Group is actually venturing into robotic surgeries where patient is not surrounded by a doctor, but he is surrounded by robots. Yeah. So I mean, this is the major technology shift which is happening, and Apollo Hospital has also introduced robotic surgeries in lots of fields like cardiology. Of course, nephrology is one of them, neurology, urology. So these are the fields where Apollo Hospital is trying to bring robotic surgeries. You would be surprised, I mean, your viewers would be amazed to know this, that the first robotic surgery which happened where American doctor actually operated a patient who was actually based in France. So I mean, that is I mean, the dynamics where we are entering.
But where is that coming from? If we're actually getting to a trend where we're having robotic surgeries, what is the reason for us having or advancing into this technology? Is it because of the fact that we might be having less human labor force, or is it just a technology that is meant to fasten the process?
No, it's a technology which is bringing better outcome, because from medical perspective, that what matters the most, where the patient is discharged quite early, I mean, a conventional maybe operation could take maybe 7 days or 10 days for a discharge. Robotic surgeries might take in general 2 days or 3 days. So I mean, that is the biggest shift, where patient recovery is faster. The surgery the hole which is made on a human body is much smaller, so the recovery process is much faster, blood loss is much less. Yeah.
Well, I'll just come back to Doctor here. I would like to know from you, when it comes to issues to do with the kidney, I guess people take long to even know that they have any kind of kidney complication. And this is where maybe most Kenyans do, or most of people in the world, in Africa as well, do have a problem to even find out that they, you know, have these kidney complications. So I would like to know from you as a specialist, what are the very first symptoms that could show that you actually have a kidney problem?
Yeah. Unfortunately, sometimes you may not even know that your kidneys have failed till they've completely failed, and you'll end up into an emergency. So, and sometimes you might get symptoms like swelling over the feet, as I just mentioned, shortness of breath. So the best thing would be to have preventive health checkups. High-risk people like diabetics and hypertensive at least should always be screened for target organ damage, what we call is kidneys, heart, and eyes. Because if they have diabetes, diabetes and hypertension, unfortunately, don't cause any symptoms to the patient. So half the time the patient don't even know they have it, and if they have it, they're very casual about it. So they need a very, very good control of it. And plus, every 6 months, 1 year, they should have an evaluation of their kidney function. So if you're doing that, you're catching them early, and by catching them early, you're actually preventing further kidney damage being occurring. Because kidney failure treatment as per is very, very expensive. In any of the developing countries, actually even in developed countries, it turns out to be very expensive. So we have actually focusing on preventing the development of kidney disease, because it's much cheaper to do that rather than treating kidney failure, because the options they have is dialysis and transplant, which both turn out to be very, very expensive. Even if it is state sponsored, it becomes a big cost burden to the state. If it is the person is paying, it's a big cost burden even to the patient. So that's why I think preventive health checkups, or people who have diabetes, hypertension, or have a family history of kidney disease, actually should go for regular evaluation.
Well, if you have any questions in regard to kidney complications, we'd like to hear from you. Use the SMS number 8040 and ask the question that you would like to ask here. You know, sometimes people are diagnosed with I beg your pardon. They have these symptoms that, you know, they actually cannot easily tell. That is why I wanted you to bring it out quite very clearly, that, you know, you can actually tell you're having a kidney problem or something wrong with your kidney if you are having these signs and symptoms. Probably you are not passing out enough urine.
Enough urine, yes.
Yes, but then we'd also like to know the other signs and symptoms.
Sometimes you might have passed blood in the urine. Sometimes you might, the frequency, the night frequency goes up. So you're supposed to sleep in the night. Sometimes you wake up from passing urine 3 to 4 times in the night. That should be ringing a bell in your mind that something is wrong. You start getting swelling over your feet. Your appetite starts slowing down. You're not interested in food. When you look at food, you start throwing up. So you're easily fatigued, easily tired. Or when you sleep and you're short of breath and you have to wake up. You can't lie down flat on the bed. So all these are signs and symptoms that we should at least go to a doctor. So anything which is different from the routine should send you a signal that you should go for a checkup.
And when someone gets to know that they have a kidney complication, how long would it take for them, if they're actually going to have any surgeries done or any transplants done, how fast should that be before it can actually get out of hand?
So once the kidneys fail, you don't have much options. You either go on dialysis or you go on transplant. So you have the treatment options only in the early stage of the kidney disease. Once you are in that stage, then you have, the only thing you have is dialysis and transplant. And as I said, they both turn out to be very, very expensive. So best thing is to prevent kidney failure, and if you can't prevent, if you have kidney failure, slow its progression. So if you're in continuous touch with the doctor or nephrologist, even if you have kidney disease, there are medicines, there are diet advices where you could slow, the time to reach dialysis or transplant is at least delayed, if not stopped.
Wow. And now I will get to Jignesh. Jignesh, I would like to know, when it comes to the Apollo hospitals, do you specialize only in kidney surgeries, or is it just general that you actually do quite a number of them? And how many hospitals do you so far have in Kenya and in East Africa, or in Africa or across the world? We'd like to know about that.
We have at the moment, like now, we have 54 hospitals altogether, 10,000 beds. So that makes Apollo Hospital Group the largest in Asia, one of the biggest in the world. We are very soon planning to put up a hospital in Tanzania. Kenya not yet, but yes, we are definitely looking forward, like, you know, for a good collaboration and partnership where we can maybe come in this part as well. Coming to the second question, yes, I mean, we are specialized on the tertiary care, like, you know, where yes, I mean, organ transplant is one of them, because in 2011 we did 929 organ transplants, solid organ transplants, and that makes Apollo Group the busiest organ transplant program in the world. Other than that, like, we also have specialization in oncology, that is cancer, very common here. Yeah, we have specialization in heart related problems, neurology, nerve science. We are also specialized on the gastroenterology side and emergency medicine.
Okay, and what has been the study that has been done, for example, in Kenya, now that you decided to come down to East Africa? For Kenyans, what is the experience like so far?
No, I mean, what has happened over a period of time, like, because lots of patients do come to Apollo hospitals, so like, I mean, mouth to mouth, so patient informs other relatives. So we have been receiving lots of patients at Apollo hospitals. The reason we felt that we need to have some regional presence is that at times the patients are misguided, they come and at times there is no requirement for treatment. Yeah, I mean they can actually take help of the local hospitals here. So what we have done basically is we have actually put up patient liaison center, Apollo Information Center, where patient can actually get the right information. Again, the patient can decide which Apollo to go for, because we have 54 Apollos, and we have each having some center of excellence in different fields. So we have here our patient liaison center, which is in Parklands area, with a partnership with Travel Associates at Regal Plaza. Yeah.
Okay, and well, because we're running out of time, I'll just get back to Doctor here, and I would like to know from you, in case someone is someone has a kidney problem, how would you advise they actually treat their diet when it comes to the foods they need to eat and what they need to stay away from? What kind of advice would you pass on to?
Okay, well, if they had kidney failure, they would at least need to cut down on their fruits and all food which contain a lot of potassium, like coconut water, dry fruits, and most of the fruits we don't ask them to eat. So that is if they have kidney failure. We also, in the early stage of kidney disease, we also ask them to cut down on their protein. So if in a meat eating society, red meat is something, if you have kidney failure, we would ask them to cut out.
Red meat.
Red meat, yeah. Fish is fine. Chicken once in a while is okay, but red meat is something most of the time, at least back home, we just ask them to avoid. If they're primarily red meat eaters, we tell them, okay, once a week, but at least cut it down. If you have kidney failure. If you don't have kidney failure, this is not a problem. But if you had infection in kidney and all, then the diet really doesn't matter.
Okay.
If you had stones, it would depend on what type of stones you have. So then the diet advice would change.
Well, in this case, I'll just have your final remarks. What exactly would you like to tell everyone out there who cares much about their health? And as a nephrologist, I would also like to know what message you have to everyone out there who would like to probably do a transplant and anyone who would like to access affordable treatment.
Coming to the first question, that message, look after your health. Your car also you need to service every once in a while. So if beyond the age of 40, 45, go for regular health checkups. Even if you are healthy, even if you don't have any disease, once a year, once in 3 years or 4 years, at least have a total body health checkup. So sometimes diabetes may be picked up, sometimes hypertension may be picked up, something may be picked up which might require to be treated, and you catch it early. If you already have diabetes, hypertension, then yearly checkups for looking after your kidneys. Any change in your body, get up and get a checkup done. And if you wanted a transplant, we are open. The license center is here. We do transplant which is only family related. The advantage of the information center, which I wanted to add to Jignesh, was that there are times when people come there and they have tuberculosis or something and they can't be transplanted. So what we have done in other countries is that they send us the reports, we go through it. If there's anything further required, it can be done back home. So when they come there, the stay is minimized. They come in, they get the transplant done and go back home. And then we're also trying to liaise with the local doctor so they don't have to keep running back and forth. And the treatment can be monitored from there also. So one reason for putting up this was that, I had some patients who went back after transplant, didn't have a good follow-up, stopped their medicines, lost their kidneys. So that was something very worrying for us, because you're spending money, somebody is donating an organ, and for some reason, some strange reasons, they lost their organs.
Well, let me just ask a question that came to my mind. If someone's kidneys are both affected, does this mean that the person has no chance of surviving?
No. In today's era, nobody dies of kidney failure. Nobody dies of kidney failure, provided they go on regular dialysis or get a transplant done. So they may die of a heart disease because kidney failure patients have a high incidence of cardiac problems. But per se kidney failure, no. There are patients on dialysis for 20 years, 15 years. After transplant, people have managed to live for 20, 25, 30 years. So kidney failure is not a death certificate anymore.
And probably if one of the kidneys is taken out, how big or how small is the lifespan of anyone living with one kidney?
It doesn't affect at all.
It doesn't affect it.
Because when we do transplants, we take one organ from